Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health care headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. Now, first, what's most urgent? The ACA marketplace is still a tumultuous field of discussion, but hospitals and healthcare providers are holding on to hope that the fight isn't over yet. Due to the expiring enhanced premium tax credits, enrollments in healthcare.gov and marketplace plans are down from last year, and many enrollees who are automatically enrolled are not planning on paying for their coverage, resulting in what's called effectuated enrollment. We should know more about the damage that the expired subsidies will have in the summer after those premium deadlines pass. But for now, hospitals are looking to the individual states to provide the support families will need to maintain this coverage. However, for beneficiaries of Obamacare, premium subsidies may be extended yet another 3 years. The House voted to extend the subsidies last week, but it has yet to face the Senate. While the Senate has been failing to form a compromise that could bring the subsidies back so far, a bipartisan group of senators is making headway and establishing a way forward that could restore coverage for many Americans. Now on to the damage report. Let's look at America's overall health rankings from 2025 compared to the past years. First, let's look at mortality. Overall, drug deaths in the United States have been decreasing, but have increased for ages 65 through 74 and among Black populations. In 2024, 14.3 million adults contemplated suicide, 4.6 million made a plan, and 2.2 million attempted suicide. The recent rankings have not considerably varied from past years. The top 5 causes of premature death in the last report period were unintentional injuries, cancer, heart disease, suicide, and homicide. COVID-19 was previously in the top 5 causes, but hasn't even ranked in the top 10 most recently. Next, we'll look at mental health. Between 2024 and 2025, the number of mental health providers increased 5%. Mental health factors that haven't changed, including frequent mental distress and suicide. In 2024, 122 million Americans were living in areas with a mental health care professional shortage. Lastly, let's consider a few rural rankings. Although physical inactivity has been decreasing overall, it was 1.2 times higher among adults living in rural areas compared to urban areas. Cancer screening rates continue to rank lower in rural areas than urban areas, but the overall rankings are improving across both areas. Flu vaccinations have been decreasing each year, especially in rural areas. The most recent report ranked urban area vaccination rates at 1.2 times higher than rural areas. The prevalence of multiple chronic conditions was 1.5 times higher in rural areas. Smoking, which is a leading cause of preventable death in the United States, is 1.5 times more common in rural areas than in urban. And now for today's success story. The very first human lung transplant was performed 63 years ago, but it was another 8 years before a recipient survived past the first month of receiving new lungs. Now, lung transplants have become a treatment option for many patients facing lung disease, cystic fibrosis, pulmonary hypertension, and more. One hospital in Chicago, Illinois, is paving the way for even more innovative transplant options. Northwestern Medicine has a robust transplant program considered one of the country's greatest and most innovative. In 2024, they completed the nation's first successful double lung and liver transplant. Since noticing how destructive COVID-19 was to patient lungs, they've been developing COVID-specific lung transplant procedures. Now, they're engaged in a race against time. In transplantation, every second matters, from the moment an organ is procured to the time a recipient spends waiting for the transplant they need. Their vision is to find new ways for organs to last longer than has been historically possible and achieve higher rates of transplant success by innovating the way procured organs are treated, as well as the care recipients receive post-operatively. With programs like this advancing the field of transplants, it's exciting to consider how much more will be possible into the future. Thank you to our sources for this episode: KFF Health News, NPR, America's Health Rankings, Becker's Hospital Review, the American Lung Association, and the Journal of Thoracic Disease.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.